From a technology and data perspective, what are clinicians excited about that they're going to be able to do as a result of new technology or new methods around data and data delivery? What are you hearing that they're talking about at this point?
I do think a lot of it points to telehealth being a more standard thing. I was amazed that some clinicians weren't really using telehealth before, because telehealth has been around for a long time. There's been, communities, organizations stood up for over a decade discussing it, but some just never really embraced it, or the organization didn't embrace it. So I really do feel that telehealth is here to stay from a long-term perspective and is a way to reduce costs. Another thing which we've been talking about, home health, trying to care for the patient from a remote standpoint, is a very exciting and intriguing thing for a lot of our clinicians. And how do we expand on that, especially from a primary care perspective? If I'm responsible for the patient holistically and in the community, how can I do this at a low cost, but more innovatively and remotely? Another thing is the data. Again, we are deep into several decades now of electronic health records and using other applications to meet the holistic workflow of the patient, and being able to own that data and now pivot to how do we use it effectively for research, algorithms, predicting a patient's health, and how do we successfully, proactively have that conversation with that patient and show them, if you continue on this trend, here's what it looks like, and here's how we can go together to maybe mitigate some things ahead of time that we couldn't years ago. So the data, I think, is going to be very, very powerful in this next 5 to 10 years.